one thing about health and healthcare is that it is something that affects us all. So these are just some examples to remind us all of where we are today and to also demonstrate maybe that these are solvable problems. The US is by far the #1 spender in healthcare. So if you look at it on a per capita basis, we're about 30% more expensive than the next most expensive country. That's Switzerland. Everything is expensive in Switzerland. So to be more expensive than Switzerland is a really sad state of affairs. But when you look at health outcomes, so this is the World Health Organization's ranking of countries by outcomes, we're 34th. Number 9, no one pays for prevention. So our healthcare system spends a ton of money on emergency rooms, surgeries, when we're really ill, spends a ton of money. But for things that keep us healthy, no, doesn't spend, ignores those things. So encouraging us to eat better or to exercise or gym memberships, any of that stuff, no, can't even imagine having that paid for. And yet if we paid more for prevention, not only would we be healthier, you could actually reduce the cost in the entire system by preventing these things that are so expensive downstream. And yet we don't do that. It's nearly impossible to find a doctor. So I now have been here for almost 3 years, but when we arrived, I had to find a pediatrician for my boys. And it was really hard. You ask around, you try to find, is there any resource online that's useful? No. You ask around and eventually you find some names, you call, they're not taking new patients, they don't like your insurance. It was really hard, and I'm the dean of the med school. Number 7, no one reminds you to take your meds. So the #1 reason that medications don't work is that people don't take them. #1 reason. And in fact, half of people are not taking their medications as directed 3 months after they're prescribed. Half of people. So here we spend all this money trying to develop new drugs, and yet we don't even have a simple reminder system, apps, checks of whether you filled your scripts, any of that stuff, to even see whether, and help people to take the meds that are prescribed. Office visits are way too short. So average office visits today are 12 minutes. And what can happen in 12 minutes? I mean, we've all been on the other side of that 12 minutes, right? Well, on the doctor's side, so I'm a neurologist, on the doctor's side of it, 12 minutes is not enough. We want more time too. You want time to connect with your patients. You know they got a lot of questions. You want to also hear about their cat. and you cannot even get one question addressed from a patient in a 12-minute visit. Flu management requires an office visit. So you knew you had the flu. The doc could figure that out too and tell you what needed to happen, or if there was something worrisome, figure it out just by a video visit, right? On your phone. They could just take a look, look at your throat, look at you, talk to you, and figure out what was necessary. That whole thing could have been avoided by just allowing technologies that work beautifully, like Skype, to be a part of that encounter. Number 4, you can't find an apple in a vending machine. So this one kills me. And what are the choices? They get these 20-ounce sugar-filled sodas and chips and candy bars, and healthy choices should be there, right? You don't have to choose the healthy thing, but at least the choices should be there. And yet we somehow can't figure this out. Number 3, if you're going to the doctor's office, you're seeing a lot more of the back of your doctor's head. So this is about the electronic health record again. So now, because docs spend a lot more time, at least twice as much time, documenting on electronic health records than they do in front of patients, they're spending all this time looking this way and just sort of, oh, really? Yeah. Oh, I see. That kind of encounter where docs hate it and patients hate it too. Again, a horrible, horrible system. Number 2, you can't email your doc. Email is hardly a technology, right? It's ubiquitous. Every industry uses it. And yet to email your doc is an incredible barrier, really hard. And then number 1, hospital gowns expose your rear. So this one, so I know it's the funny one, yeah, but you know, that thing is like totally dehumanizing. All of us have felt that, right? Who wants to walk around like this so they don't have to, you know, and everybody thinks it has a purpose. It has no purpose. It doesn't, nurses don't like them. They're not invented for nurses to make it easier for them to get at the back or something. And docs don't like them. When docs approach patients, they're much more interested in getting access to the front where they can hear the heart and you can hear the lungs from there. And yet they are ubiquitous in the healthcare system. They've been there for over 100 years. And no one's questioned it or found an alternative. A t-shirt and boxer shorts would work a whole lot better, be a lot more comfortable, could be individualized, and yet we don't do that. Instead, we force people into these. So it's really interesting. You know, why does healthcare not innovate? Why doesn't it recognize the human needs and evolve with them? And so this one's particularly good at demonstrating the issues in the healthcare system.